prevention and treatment of cervical cancer is highlighted in this report by Jalissa Hines.
Cervical cancer is the second most frequent cancer and the fifth most frequent cause of death from cancer among women in the world, with an estimated 471,000 new cases and 233,000 deaths in the year 2000.
Your immune system. If you have a very weakened or debilitated immune system, you will develop cervical cancer. Your chances are higher.
Dr. Vinishri Kirodar, Medical Superintendent Region 6 and Medical Director of the National Ophthalmology Hospital, during an interview with this newscast, disclosed the preventative measures one can take to lessen their chances of developing cervical cancer.
What a female or a woman of childbearing age can do in order to prevent her chances of developing cervical cancer. 1. Go see a doctor. See your physician, talk to your physician, and talk about getting vaccinated early. The CDC has recommended vaccination for cervical cancer, which is called Gardasil, from the age of 11 to 12. But we can give them from the age of 9 to 12. Here in Guyana, we have been given the HPV vaccine to young women, and it's available to the entire public.
In Guyana, according to the Minister of Health, Dr. Frank Anthony, the current uptake rate of the HPV vaccine is very low. It is about 30% for the first dose and 13% for the second dose.
Another prevention is do not smoke. If you smoke, you increase your chances of developing cervical cancer. So do not smoke. Practice safe sex. Practice safe sex. Stick to one partner and do not engage in risky behaviors. The last and most important one that I would recommend, women of childbearing age, they need to get regular pap smears done or VIA. VIA is visual inspection of acetic acid. Takes about 5 minutes to get that test done and you have your results. So if you do it regularly, you would have avoided your chance from that turning into cervical cancer and can be easily treated.
Cervical cancer is generally viewed as treatable and curable, particularly if it is diagnosed when the cancer is in an early stage.
Treatment of cervical cancer includes surgery, radiotherapy, or chemotherapy. The choice of these treatments depends on 3 factors. 1. How advanced or the stage of your cancer. That's the staging of the cancer. 2. The age of the person. 3. The overall physical health of that individual. So in order for you to select a treatment of choice, you have to consider all these criteria. So if a person has advanced stages of cervical cancer, they have HIV, they have diabetes, their chances of surviving is very low, or their success rate is very low. If it's early stage and it was detected early, the person is young, physically well, their chances of survival, their success rate is very high.
Regarding the services offered in Berbice and by extension Guyana, Dr. Kirdar added,
We have various sites that does VIA testing, Skeldon, Port Morant, some of the major health centers, and New Amsterdam Hospital. It's located directly where the blood bank is. So once we would have find a positive case, we have detected a case, whether it's early or latent, we would have later send a patient directly to Georgetown. There are some New Amsterdam and Skeldon where they practice certain basic treatment. However, should they diagnose it's latent or an advanced stage, that patient is remitted to Georgetown. Because chemotherapy and radiotherapy, surgery, for all of these, they're done primarily at Georgetown Public Hospital. But local cases, and that's cases that have early signs or no signs at all, they are dealt with and treated here, and then the patient are given yearly appointments to follow up on your VIAs.
In conclusion, Dr. Kirodar said,
all of these taken into consideration, cervical cancer have a lot to do. The choices you make in life, that's your lifestyle choices, whether you're a smoker or not, whether you practice safe sex, and that is having multiple sexual partners, the use of certain drugs, especially those to prevent miscarriages, etc., and the environment you live in. If you're living in an environment that you're exposed to a lot of toxins and toxic material, then yes, that can impact and that will also contribute to your chances of developing cervical cancer.
Reporting for Channel 8 News, I am Julissa Hines.